many of them have, they're proven beyond doubt, have suffered brain damage.
Many of them suffered the most weird and wonderful sorts of brain surgery too, apparently, without their knowledge.
That's right. We now have 4 cases as a result of the series, and 3 people have come forward. There's one already known, where they've had metal plates or metal clips inserted in their brains completely without their knowledge, and certainly, of course, without their permission.
Well, what strikes me as most staggering of all is that these deaths were never really worried about. I mean, people died, other hospitals had to clean up the mess afterwards. The profession of psychiatry eventually found out what was going on, but the cover-up was complete and all-embracing.
In Australia, habitual thieves, sex offenders, drug addicts, and people with chronic obsessional behaviour have undergone psychosurgery by a team of doctors in Sydney's Macquarie Street. The team, headed by psychiatrist Dr. Harry Bailey, who declined to appear in this programme, has carried out more than 150 brain operations over the past 7 years. Operations by his team have been carried out by neurosurgeon Dr. John Dowling at Prince Henry Hospital in Sydney.
It's very simple. A couple of burr holes or small holes are placed in the bone of the patient's skull, up in the top part of the hairline, and a probe is inserted deep down into a centre of the brain, which we call the cingulate gyrus, and a small lesion, a small destruction of the brain fibres is placed. If you like, a small block is placed on the telephone wires, not completely blocking them, but partially.
The operation lasts only about 2 hours. Most patients are said to be discharged from hospital within a week, recovering at a private hospital in a Sydney suburb. Dr. Bailey rejects criticism of psychosurgery outright, claiming there is no question of ethics involved. Each operation is carried out with the patient's permission, he insists, and the vast majority are improved by psychosurgery.
There is always an element of risk in major surgery, but you are entitled to expect that the decision to operate in the first place was based on hard medical evidence. But for one Sydney man, that was not the case. He was told he needed psychosurgery, a drastic operation on his brain to cure a psychological problem. But as Tracy Bowden reports, by the time he emerged from the hospital, even his own son barely recognised him.
When I came home from hospital, he said to his mother, he said, Mum, he said, what happened with this operation? He said, something went wrong in this. Dad is not the father that I used to know. And that's from a kid who was deaf.
Bill, as Will called him, was a skilled sheet metal worker for 22 years, but brain surgery put an end to his career. These days he works as a gardener because it's one of the few things he can remember how to do. Bill's problems began when he complained about pain behind his eyes. The tests showed nothing, so Bill was referred to a psychologist.
He psychoanalyzed me with Zülliger tests. They're like someone's gone mad with a paintbrush and thrown this paint onto cardboard. And through that, they determine that a person has to have brain surgery, as it was in my case.
So after just half an hour of psychological tests, Bill ended up on the operating table. Doctors told him it was a simple procedure that couldn't go wrong. But by the time Bill was wheeled out, his life had been turned around. Psychosurgery had left him with a horrifying string of new problems.
Epilepsy, permanent brain damage, change of personality, lost me my job as a skilled sheet metal worker where I was for 22 years, disrupted my home life, destroyed my sex life.
Hundreds of other patients have been subjected to the same operation as Bill, and we know that at least one has died. It's supposed to cure everything from petty stealing to sexual exhibitionism. The doctors who do it even claim it increases your IQ.
After this surgery, I was supposed to have an IQ of 111. That'd make me pretty well up with the brainiest persons in the world. Instead of my IQ was lowered.
It was these ink blot tests, the Rorschach and Zülliger tests, that were Bill's downfall. The Zülliger test is made up of 3 cards. As we show you the cards, compare your response with those of another patient we'll call Harry. In this card, Harry saw a monster or an animal. In the second card, he saw the red shape as human ribs and the area inside the body. The brown shapes at the bottom were two animals butting each other. And the third, Harry saw two jesters or a fancy dress ball. The red mark in between the two figures was a butterfly. If you saw the same things as Harry, you may be in trouble. On the basis of these sort of tests, Harry was rated by his psychologist as a paranoid personality and committed for electric shock treatment.
It's totally unethical, I think, in 1985 to be using instruments such as the Rorschach to designate people for psychosurgery, for example.
Dr. Peter Birrell is a senior psychologist who finds it unbelievable that the inkblot test is still used for any purpose.
It's based on a false set of discredited assumptions. It's unreliable, it's invalid, indeed it's essentially shonky. There's no point in saying whether individual psychologists have their own individual interpretations, because it's no better than reading tea leaves in a teacup.
Is it possible to explain to someone just how you do feel now, how you feel about what's being done to you?
Resentful, bitter. Because what's been done to me shouldn't be done to a dog.
Tracy Bowden reporting that man's operation was performed in the mid-1970s, but psychosurgery is still used regularly in Australia. In New South Wales, there are about a dozen such operations every year, and doctors now have to satisfy any operation before a special committee, but only if the surgery is carried out in a public hospital. There are no controls at all on the sorts of tests that psychologists can administer, unlike many states in America where inkblot tests have been banned since 1965, even for testing job applicants. And finally, no action has been taken against that man's psychologist by the Australian Psychological Society, even though a formal complaint was lodged more than a year ago. We'll be back with more in just a moment.
I was a sheet metal worker who had been suffering from blurred vision.
I got a phone call from his nibs. He said to me, "Would you like to go to my own little hospital at Penn and Hills?" I said, "What for?" He said, "At breast." I said, "Is there anything else involved in this?" He said, "No." Maybe it's all changed to me, but I still know the outlay of the place, where the zombie room was, where you...
And now an ombudsman's report to confirm what he knew all along.
There's one law in all of Australia controlling the use of psychological testing. And as we can see from this episode, psychological testing can have a tremendous effect on people's lives.
Professor Wayne Hall, a respected psychologist, was asked to assess the testing procedures of Dr. Evan Davies.
By most of the usual standards of what constitute competent testing, he'd broken most of those rules.
So you were deeply concerned with these practices?
Yes, and I still am.
Barry Hart is still frustrated. He first lodged a complaint about Dr. Evan Davies with the Australian Psychologists Society in the early 80s.
And the APS dismissed the complaints on the basis that there was no way that they could do anything about Evan Davies, because at the present time psychologists weren't required to be registered in New South Wales.
The Psychologists Registration Board was set up in 1989. By the time the Royal Commission into Chelmsford was well underway in 1990, Dr. Evan Davies applied for registration and was accepted just 16 days before the Commissioner handed down his findings that were highly critical of Dr. Davies' practices. Today, Ombudsman Irene Moss released her report into the Psychologists Registration Board.
We would say that there is evidence which points to the board being a rubber stamp.